Fungal infection will often present as kind of discoloration in the toenail, yellow or white, depending on the type of fungus present. It's also thick and can get quite crumbly. The longer it has been there, the more crumbly and softer the nail tends to get. Treatment will often involve, initially the GP or podiatrist might suggest that you paint the nail with a nail lacquer. You can either buy these over the counter or fairly often get them on prescription off the GP. Next line of treatment would be oral medication from the GP. GPs can be quite reticent about prescribing this. It can have other knock-on effects. Reported side effects are very rare, but GPs seem to be quite concerned about this with regards to liver or kidney function. It usually takes around 9 to 12 months for an adult big toenail to grow from the very root all the way out to the tip, and you need to be taking the medication for that whole process. If you stop short of that, so 6 months in, there may be traces of fungal infection still in the edge of the nail, and there's a severe risk that it will just regress back into the nail if you stop treatment at that point. You will quite often find, particularly in patients who have long-term fungal infection in the nails, that it will also affect the surrounding skin, the sole of the foot and in between the toes. So in between the toes is what we classically would call athlete's foot, and the two will often come in combination. And if it's left untreated and is there over a long period of time, or there might be other health concerns where the immune system isn't particularly strong, then you are at risk of fungal infection spreading along the sole of the foot. Again, it's fairly common for patients to be moisturising their feet, have problems with dry feet. Another point to note, however, is if a nail is thickened and damaged as a result of trauma or a fungal infection, if you treat the fungal infection, the discoloration of the nail will improve and hopefully go, but the likelihood is that the thickness of the nails will remain. So if your primary reason for treating a fungal infection is that you're having difficulty cutting thickened nails, you may be best just considering seeing a podiatrist on a regular basis to maintain nail care, because as I say, treating the fungal infection won't make your nail cutting particularly any easier once that fungal infection is gone.